everyone. Welcome to the Trial Site News podcast. I am Dr. Erin, your host. Thank you so much for joining in. Today, we have two special guests. We have Sean Kiernan, who is the CEO of Weed for Warriors, and we have Brian Chadwick, who is head executive director of the 100 Million Ways Foundation. Thank you guys so much for joining us tonight.
Thank you for having us.
Absolutely. So you guys have missions that overlap. I wanted to dive a little bit more, for people who may not know, and sometimes there's still this stigma when you hear weed or marijuana or cannabis, right? And I certainly don't think that way. I've seen it help people myself. But can you dive in a little bit to the research? How is weed specifically? It's okay if I say weed, right? Like cannabis. Okay, cannabis, cannabinoids. I'm afraid I can't pronounce that for too long. But how is that helping people with their symptoms? How is it helping people who may have been prescribed opioids and developed a chemical dependency or an addiction? How is it helping with veterans, who are dying by suicide at a much higher rate?
You asked a better question. I mean, it's my favorite quote. You think about, again, this real world evidence versus scientific evidence. And you think about the data that you've collected. Now, as I was researching a long time ago, but I've saved this one. Listen to this. Sir John Russell Reynolds, physician to Queen Victoria and president of the Royal College of Physicians, wrote in Lancet, 1890, "In almost all painful maladies, I have found Indian hemp to be the most useful of drugs." He thought cannabis might help reduce the need for opioids. He said, "The bane of opiates is relief of the moment, the hour, and the day, and is at the expense of the side effects." 1890. So that's where, a lot of people have been doing this for a lot of time. But Sean, why don't you talk a little bit about the real world experience you have?
Yeah, I mean, first, it's really important that people understand cannabis is included as a Schedule I drug, not because of its danger. I think that is widely held now that it doesn't belong there. So I think we have to first admit that a lot of the propaganda we were told as children starting in the 60s, 70s, and 80s was just factually inaccurate and straight propaganda. And once you are able to accomplish that, then the question is, what can it be used for? And, I kind of call it the people's medicine. And I say people's medicine because it's accessible to so many people. There's a reason poor Black and brown people have been using it. They were one of the targets along with the hippies of it, outline it. And that is, it's affordable. It's a weed. It grows in the ground. The last thing corporate America wants, or people who want to make a lot of money off prescribing you drugs, is a substance that you can use and access without really them. And so if you ask me, instead of taking Xanax, which by the way is deadly, well, I think it's one of the more third or fourth on an overdose chart.
Well, now it comes cut with fentanyl like everything else.
Right. So instead of Xanax, for anxiety, a veteran can go smoke a joint or take an edible. To give you an example, holiday seasons, it's famous with the veterans. We got to make sure we're stocked up when Thanksgiving and Christmas and Hanukkah are around, because what happens? Family comes over and they annoy you to all hell. Well, without cannabis, we're screaming, ranting, and raving back. On cannabis, we let it go, right? So it controls that anxiety, it controls that anger outburst that so many people, not just veterans, a lot of Americans have, because we're stressed out. On opiates, right? So instead of that opiate I take that impairs me for driving, that gets my stomach sick and makes me throw up, and worse, has the worst addictive property of any of the legal substances we give, cannabis is nowhere as close. So we're more likely, by astronomical effect, to addict someone on it. Cannabis doesn't take away the pain, just like opiate doesn't, but it helps you manage it, right? And so it manages the pain. And beyond that, appetite for people who have cancer and need to stimulate their appetite. Glaucoma, there are very well documented, widely accepted medical benefits to cannabis besides that. But the important thing here is think about if I want Xanax or I need a pain reliever, opiates, what you have to jump through now in today's government. I literally have to go to a doctor. He's going to prescribe me a limited amount. I'm going to have to keep going back to him, pay a copay, or I can just get a couple joints and take 2 or 3 joints a day. And we're seeing that where cannabis is available, we're seeing less pharmaceuticals being taken, less opiates being taken. And that's a good thing, less alcohol being consumed. We're seeing lower domestic violence issues. So what we're seeing is a positive effect in our communities for a multitude of reasons. So when you ask, what can cannabis be used for? As I said, it can be used in lieu of pharmaceuticals, but more importantly, and as important, it can be used as a substitute for the horribly illicit drugs we take. And that is all the drugs that are legal, but now cut with stuff so the drug dealer makes money, right? The heroin that I have to go buy because the VA or my pain doctor cut me off because the war on opiates has left opiates almost impossible to get for many too, right? And what we're learning is we don't control our community. So this idea that we're doing anything but causing and wreaking havoc with our communities and our family is a figment of somebody's imagination. Drugs are easier to get than ever. They're more as the addiction rates are as high as ever. And we spend billions and billions and billions a year on enforcement and the propaganda that is not truthful to the American people. So we're not able to propose best public policy because we're not even on the same page.
And another thing, Aaron, that brought us together and drives the same issue is that people with people that have OUD, opioid use disorder, over 60% of them also have a diagnosed mental illness. Veterans with PTSD, over 40% of them also have a challenge with opioids. You know, when we talked about this and we realized we had not only the same objective, what does this cannabinoids thing do and how can we make it more available for people that need it? But mental health is kind of the theme that came out of the pandemic. And we're really excited to say, we mentioned to you when we spoke before this podcast, last night and tonight we had our first 2 programs for our veterans with PTSD, moderated online support sessions with a professional moderator. And it's a pretty exciting day and 2 days for us both.
Can we talk a little bit more about that? Because I know that was part of your coming together was to do this pilot program,
Yes,
so to speak.
right.
So
it's mental health is health, and again,
mental health is health.
I think that we decided that we don't care why people are having mental illness or PTSD or opioid use. They're having mental challenges, and mental wellness has been something that's been overlooked for a long time. It's become a priority for 100 million ways. With Sean, we're realizing that it's a shared priority. And Sean did a lot getting the veterans involved to participate in this. I spoke to every one of them on the phone about participating. It's been a very exciting couple of days. Sean, you want to talk a little bit about it?
No, I mean, it's, you know, we always, Mark Carrillo, my partner, Marine, great guy, and myself and his spouse, his caregiver, has been vital in helping us put this together and helping. Listen, we get stuff because we're about access. Do you have weed? And do you have cannabis? And we get that free to our vets. But then there's all I thought, well, what mental health, outlets do you provide? Mark and I look at this, we're 100% disabled vets too. I have 100% PTSD rating. I got to worry about I'm not even good with myself, let alone helping others on that environment. So we always get shit and we're like, we need to be in the group, not just running it. And so we literally, when Brian came along and bought some of the people he bought together, including, some research at the UCSD and the companies coming out of, the University of California, San Francisco, I believe it was Brian and Stanford and doing that work up there. What I saw was credibility. And, one of the things, I'm an ex-Wall Street guy, and I went from one extreme to another. Now, people call me Che Guevara light. And so I think, having that credibility of Brian and the institutional ability to have this potentially very good tool for our veteran community at its disposal, free of charge to them, because the industry that is coming together to really help us is coming to the table with money to pay for these things. And so it was a really easy answer for us to say, yes, we're very hopeful. One of the things we noticed is our chapters that we ran were monthly. And so in places from Los Angeles to Sacramento to Florida to the East Coast, throughout the East Coast, we ran monthly chapters. With COVID, that's gone away because we can't get veterans, at least officially, in any large number together. And that's had a huge downturn. We've had many veterans take a downturn. They look forward to coming together. We had parents say, this is the only event my veteran son or daughter gets out of the house for, right? Or the only event my grandfather gets out of the house for. We literally had Korea vets all the way to vets who just got out last week come together, smoke cannabis, talk, and it was community, right? Well, the great thing about what Brian is coming to the table with the institutions we're working with is try to bring that community online, try to bring that in community to an on-demand. So when a veteran's having a hard time, they developed a support structure at these chapter meetings, right? They could call these veterans. These veterans would stay on the phone. They'd come over to the house. They'd interdict, make sure nothing bad has happened. And we've been doing that for years and years, since 2014. What we have here is an opportunity to take that small environment that's hard to replicate on a large basis and try to create something that we can replicate, so we can go from helping thousands to tens of thousands, if not hundreds of thousands of veterans. And if it works for veterans, why doesn't it work for every American? And so that's kind of what we're trying to do here, is bring not only the cannabis story together, but that kind of mental health and community group therapy, group talk sessions together that we've seen in person. Again, anecdotal, right? I can tell you, I got 10,000 individual stories of kids coming to me to say, Sean, cannabis gave me my mom back, but researchers flip you the bird when you bring that up because they don't really care, right?
Right.
And the same thing with these group sessions. We saw it wasn't the cannabis that healed. Cannabis allowed the person to come together into the community, which then healed them. And that's my view from what I've seen.
Yeah. It's interesting, this whole thing about anecdotes, and when we get into who funds research and that kind of thing. I saw this woman and this tweet she had, and it said something like, an anecdote equals pseudoscience. And I'm like, well, an anecdote can equal a hypothesis. An anecdote can be the start of recognizing things that work. So it was just like, to me, she had such a jaded, maybe corporate influenced view of that. It's like talking to millennials about our Constitution. It's and I joke a bit about that thing. It's kind of talking to corporate research scientists. No, it's an observation. An anecdote is nothing but an observation, and science is made up of lots of observations, right? Yeah.
To prove awesome. So to me, that's an ignorant statement, but it's unfortunately a statement that we hear quite often from people who are paid and paid well to push an agenda that they don't seem to admit they have.
Right. And I always tell people that. I'm like, what gets studied is what gets funded. There can be so many research questions out there, but if no one's willing to fund it, you're never really going to get an answer. But I think, a series of observations, anecdotal evidence, that's really powerful. And it's really powerful coming from the veteran community.
Listen, we've been giving anecdotal stories, and guess what we said? Cannabis makes it less likely I'm going to off myself. UC Davis this year, with Yale's help, published in the British Journal of Medicine in January, where legal dispensaries exist, opiate deaths are lower. Now, that anecdotal example is common sense. If someone takes cannabis and they don't take heroin, they're asleep on the couch with Doritos. If someone takes heroin, they're playing Russian roulette every time they get high, and they may stop breathing at some point. And so to me, it's tying the anecdote, it all together. And the data is now coming out proving where cannabis is legal, accessible, not even legal, lower suicides, lower overdoses, lower alcohol use, domestic violence, the violence associated with domestic violence lower 18%. These are actual studies by American universities just analyzing the data.
Important to note here that because people will tell you, oh, that's just, a review of data or a review of literature. Well, that may be, but there are at least 3 substantial studies by the likes of big institutions, including UCSD, Johns Hopkins, that have come to the same conclusion. Again, something's going on that has to be explored further, because this is we talked about this. There are 27 veterans killing themselves every day.
Yeah.
Well, it's got to be something that's got to be done about it.
Yeah. Well, absolutely. I mean, we need to do more to help our veteran community.
Yeah, something can be done about it. And they're doing something about it. And we're hoping, we looked at data that said if MDMA in combination with therapy improves veteran outcomes by 80%. That's done by an organization called MAPS, Rick Doblin. Well, we figure the same thing. Cannabis is helping a lot. Now let's add a layer of mental health support, mental wellness support, and let's measure. This is going to happen tomorrow. We're just starting. But, from my kind of square side, let's measure the statistics about this. We have now this group of people that are participating in this community, online community.
Yeah.
Let's have them help us. Let's see how this combination of approaches is working or not working.
Right. To get the data, the scientific data, to present to, some of these regulatory types, to hopefully get move it in the direction that you want. I mean, it's true that we do need to have, that formal science to back up things. That's just how things work. But
real world data is getting more and more credibility today because, again, 500,000 veterans can't be wrong.
No, I agree. I mean, it's, and Sean, and maybe you could talk a little bit about this too. That a lot of this it's come from the veteran community. A lot of the veterans I've talked to, that sometimes they'd be prescribed, lots of medication, and the side effects and just dealing with all of that. And there was this movement to kind of look for other things. I mean, there's lots of veteran run grassroots initiatives to try to, embrace this holistic approach to healing. And to, they would say, hey, I don't feel good on these medications. I'm on like 20 medications. So, I mean, I'm sure I know stories like that.
Yeah, no, we have a tremendous number. I mean, myself, partners, 20, 30 pills a day, from opiates, Xanax to sleeping meds, to mood stabilizers to they run the gamut. And the constant refrain is, I don't feel good on these. I don't like myself on these. And they choose to self-medicate. Then it's a question of if they're going to choose to self-medicate. See, to me, this discussion on medicine, while accurate, isn't the tip of the spear to me anymore. Why? Because you're getting into how do you define medicine and who defines that. And that's the situation we find ourselves in. It took CBD, Epidiolex, almost $1 billion to get through clinical trials to be called a medicine. That's CBD. Pennies on the dollar you can get legally, right?
Right.
And so to me, it's a bankrupted model we're pursuing. There needs to be an alternative, because at the end of the day, the veterans and non-veterans are going to choose to self-medicate if they don't like the pharmaceutical approach. And that's happening whether you agree with it or you don't agree with it, right? So is it good public policy? Try to minimize risk. I think we've decided a long time ago, yes. And so if we're trying to minimize risk, what we're trying to prevent is that Narcan. No, we don't want you to be on Narcan. You have to use Narcan, because long before you get to that situation, you found cannabis to be working for you, and it's legal, and in the legal market, it's tested. In California, for example, every audit of a purchase at a legal dispensary has been rejected by anyone under the age of 21, unless you have a medical recommendation. We can bring good public policy to our communities. We got to listen to science, and the science just isn't about what is medicine, but the science is about the outcome and how effective our policies. So when we look at where cannabis is available, it may be associated, then the question is, let's talk. If someone shot up heroin or did cannabis as your next door neighbor, everyone's going to say, I'd rather them do cannabis, right? So I think that it's a bit of a misnomer and a deflection when the people come back and say, it's just an association, correct. But if associations were means to reject arguments, the entire prohibitionist narrative would be rejected because they bring nothing concrete but loose association, like, these car accidents and, they're testing people's THC level. So you're picking up anyone who's in a car accident who smoked cannabis for the past 30 days, and it may have no effect on the actual accident. Right. They push that science. That's a bad association. That's clearly identifiably a bad association. You can't say that with these associations. We need to start to delineate between the quality of these studies. When you have UC Davis and you have Yale, and you have the British Journal of Medicine putting their name on it, it's passing mustard for anyone arguing against it. And we need to start listening to that because it's the best data we have. The reality is perfect doesn't exist. I mean, all we have to look is the scandal at Duke in research and the $100+ million fine they paid. Or we have to look at the scandal in food research, which is food companies would pay researchers to manipulate data to be able to say, oh, it lowers this, it saves this. And they are. And this is examples of in real type that is happening every day in America. And we need to be able to talk about our communities and not be dismissed. And that's exactly what tries to happen is they deflect and they dismiss from the questions. The reality is, if you don't like our answer, what answer have you put on the table, government or big pharma? And the answers they keep giving us aren't being effective because suicide and overdose numbers are going up. We want the right to control our own body and put medicine in our own body. Amazing when something we keep reminding is who has control over our own body. Seems to be something we should measure across a lot of different issues.
Yeah, no, I mean, absolutely. That's a philosophical question that's being hotly debated right now.
Yes.
100%. I wanted to talk to you a little bit about the access issue, because I know when we spoke before, I was under the impression, here where I live, anybody can get weed. It's pretty commonplace. It's not a big deal. Lots of people smoke it. Lots of people smoke it in my apartment. Like it's, and I think we're better for it. I don't know. Maybe we're all better for it. My dog's pretty chill. No, but and you mentioned, that in California, I was like, oh, it must be easy to get there too. Cause I'm just not, up on this issue, on the access issue. So how easy is it for veterans who want to try this? How easy is it for them to get it and use it and be fine?
It's hard. Well, there's three different. There's the, I can't access it and therefore I want to use it, but can't use it. There's the, I can access it on the black market. And then there's, I can access it legally. When Prop 64 in 2016 passed in California, which was wrecked, it gave local control the ability to deny cannabis businesses licenses. So 70% of the state of California, ironically enough, has no cannabis business, legal cannabis business in it. And they've had the ability to outlaw delivery now too. That's something we have fought in the courts that Gavin Newsom's as governor backed away from defending. And so it's hard legally. Both there's geographic prohibition now with local control, but then there's cost prohibition.
Big, Aaron.
The promise that the corporate community made to government to get legal weed was we can tax the shit out of it. The medical community love that because they see it as a sin tax. And communities say, well, it's tax revenue. The problem with that is all you're doing is now you've legalized cannabis for the privileged who don't mind paying these very high prices for cannabis they can get a lot cheaper in the illicit market. And so all you've done is give boom to an illicit market. The problem with the illicit market is they don't test the medicines for the most part, so you have to trust who you're getting it from. Right. And then two, there's a lot of diversion going on in the legal market, meaning weed that is not passing health tests in the legal market is getting diverted into the black market. And so now we're more likely in the black market to consume tainted, dangerous meds than before because of the legal market. So the people who are benefiting from the legal market are the business owners and those who either don't need it much, meaning they'll smoke a joint or two a weekend. So if it's 4 times the price that's necessary, they don't care. But to give you an example, the federal government in their weed program, and they do mail weed to one person still, off an agreement from the 80s, they say smoke 7 to 9, I think it is, joints a day. An eighth of weed is $40 on average. It's a lot more in a lot of states, a little cheaper. You can find it consistently after taxes. 40 times 30, if you're going to do 3 joints a day, which is a fraction of what you will use, you're on $1,400 a month in the legal market because it's so heavily taxed. 100% disabled vet makes $3,000. So to say to legally medicate as an alternative to the opiates and psych meds that have suicidal ideation, overdose, and death as FDA stated risk, cannabis, to use cannabis, it would take 40% of my veteran 100% disability to do. So it should be no shock when the state of California, 4, 5, 6 years after they passed recreational cannabis, that says 80% of all sales is happening in the illicit market now. So the problem is the regulatory push on the legal industry has been a disaster. They're coming around. All we're doing by overtaxing and overregulating this industry is pushing the legal market back into the black market. And that comes with all the societal is. We had a sheriff in California shot. We have immigrant labor being exploited, with 7 monks were actually killed at a cultivation site, all because of the black market that's caused by the very policy we said was here to free the weed. We didn't. We captured the weed and are holding it hostage, paying for stuff that has nothing to do for veterans or cannabis. And the supply chain is paying an enormous toll to have that privilege, and they're only able to serve people who can pay high prices.
I'm glad you really laid that out very clearly, because I think there is this assumption like, oh, it's easy to get today. Yes. And it's not. And when you talk about going to the illicit market, we see more and more reports like overdose deaths are up. They're lacing everything with fentanyl today, which
even marijuana. There's a study at the University of California, San Francisco, and I guess this is obvious to most of us, but says clearly it was all about, it was in the LA Times, and it was about with COVID and the black market was shut down. So drugs weren't coming in, or any kinds of drugs. We were slowing down the prescription writing for all the OxyContins of the world. And paradoxically, when there's less supply available, death rates go up because people get riskier with dealers in the street and wind up taking stuff that they're not prepared to deal with. So it's really a paradox, and it's something. Aaron, it's so very clear to me that chasing the supply side is a failed effort. We've been chasing, meaning trying to shut down the borders and all this crap. Chasing the supply side. Yeah, well, in 2020, we had 100,000 opioid deaths or 100,000 overdose deaths. Well, guys, not working. Let's do something other than chase the supply side, or do something in addition to chasing the supply side at least. And I think that that's some of the things that we're talking about. And I also want to, before we go away, I want to shout out to Amanda Carrillo. She drove this first event. She is Sean's partner's wife. So she really is a lot responsible for kicking this veterans psychological wellness meetings events. And I also, because Sean is right. So, we understand the problem that's going on, and yet, as I said, we're still trying to take advantage, and I mean that, of the businesses that are making money. Columbia Care is a company in New York City. They're a big MSO, a multi-service operator, provider of. So they have multiple markets. They grow it, they sell it, they whatever. And they are giving money to us. They're giving money to us. They're giving money. They're helping Weed for Warriors do something. So, there is that opportunity to tap that marketplace, even though that marketplace is part of the responsibility for what's going on. So I keep being encouraged. I'm always an optimist anyway, but that I wrote a blog the other day about, I have 6 points, 6 things that we can do, 6 actions to take that will stop the opioid crisis. I don't think it's that hard. I mean, it takes lots of money, but it takes perspective, it takes focus, and it takes people gathering, making community to make this happen.
Yeah, I think the community level initiatives and are really where it's at.
Really,
Understanding.
one thing we're really excited about, because community is a big thing that both of us are interested in. So there was a study in the 1970s, here I go again, a guy named Dr. Bruce Alexander, and he put rats, right, in a community. He put he put rats by themselves in a cage with two bottles of water, one with heroin, one just water. All the rats overdosed. Then he took the rats and he put them in a community of other rats where they could play and eat and have sex and do all that other stuff. And they had the 2 bottles of water. No rats overdosed. A couple of them got a buzz, but no rats overdosed. And I think that's a very basic approach to what community can bring. Suddenly you have someone else to deal with, someone else who's maybe dealing with the same issues with which you're dealing, someone who can help you, maybe someone who you can help. A lot of what Weed for Warriors does, there's veterans that'll say, yeah, the weed really helped, but serving meals to the poor made me feel like I had value again.
Yeah.
Yeah, no, it's to Brian's point. I mean, even my own stuff. I mean, we didn't start Weed for Warriors with any idea other than helping ourselves. Because what we found is when we get the vets together to go out and give medicine to the homeless, we do sock drives and sleeping bag drives for the homeless because it's such an issue out in California, and we felt better. And I always chalked it up to Sebastian Unger talks about the wolf pack, mentality. Saw what drives this issue for vets. You take vets in a very tight environment and make them work together. It's camaraderie that doesn't exist back here in the States. And then when you dump these vets in the community, you're dumping them back into the very communities they came from. And in many cases, in most cases for the enlisted veterans, that's not affluent communities. Those are poor communities that are already underserved by our government and the safety net. And so when we talk about this, it's really, that's why people love to get together. They as connections, that feeling they belong, they feeling that someone, stuff they wouldn't tell anybody, they would tell us. And this is what we'd have, literally talking about Amanda Carrillo, my partner's spouse. She's a caregiver. And you talk about a group of people that are very underreported, not talking, it's the caregivers of our community. Without, most of these vets would be dead, right?
Yeah.
And we're just starting to treat them better. I mean, for decades and decades, they got nothing. For the new modern vets, they get a little stipend. That's going to be spread to everybody now and to make amends. But the point being is, this is what we always heard. I'm not alone. And we heard that not just from the vets, but the vet's spouse, the mom or dad or the brother or sister who came and then started to talk to caregivers on the meeting. So our meetings didn't just help the veterans. It literally was as big a help or bigger help for the caregivers to go, okay, I'm not the only one. I got someone I could commiserate and talk to, right?
Yeah.
And so I think to Brian's point, right, we live in a very isolating country and a very, behind the things, and we've lost community. And I think that's what we're trying to bring back to the table is community. And I think community is a big answer to what ails us.
I wanted to ask you, and Sean, maybe you could share what, I don't know if the veterans have said anything yet, but when you talk about building this sense of community and you've been doing that in person, do you feel like you can reproduce that in the digital sense online? Do you feel like it's creating a similar thing, or is there like a human touch element that's lacking, so to speak?
Couple comments. I don't think it's substitutable, meaning I would substitute it for it. But in an environment that does two things. One, it's professionally moderated by healthcare, trained professionals. So it's a little different than the chapter, which is just a camaraderie, bringing everyone together, and it was peer support.
Right.
And so it's trying to elevate it for those who need the health care aspect, that mental illness, that focus, those tools, that gratitude stuff, where the community was more just to get together. So no, I don't think it replaces it. But this is the other thing. In COVID, it's better than nothing. And so often we let perfect be the enemy of good enough. And, I'll tell you one thing I learned in the military is there is no perfect. And we have a lot of people seeking perfect, and that's part of the problem. Yeah. And I think what we need to realize is that people just need to be loved, and they need to understand there's someone there for them. Yeah. And if that comes in person, great. If that can't come in person for various reasons, then this is a great substitute. But it's also a great tool beyond those in-person gatherings that we will continue. But it is really, again, trying to bring that health care part of it, trained professional part, because as Brian said, our goal is not just to have a place where vets can go, but go on demand and not only have a place where they can go, but when they start to feel better, we found our best volunteers are people we helped. I'm a suicide survivor. Kevin, who was the one who literally thought up the Weed for Warriors and started it, he's a suicide survivor. Mark has major issues, right? We're all veterans. So, we look at this purely from the idea that, it's community that drove us, and it's the community we don't want to lose. So, we're going to try anything. We're really excited about this because we're bringing money to the table, because after this done, we get to employ these guys. Mark,
I was going to say, extend the community, what it does, Aaron. And another program, which we may have mentioned before, but as Sean is referring to now, is a certification program for veterans, opioid addicts, whoever is willing to be in the program. We pay. They get certified as a certified mentor. Now, it's not someone who's going to sit on a shimmer meeting and monitor and manage that. That's a little bit more trained professional. But it is someone that can sit, and we have another thing that we do at 100 Million Ways called Buddy Bot. And it just gives someone to connect with, somebody that can share stuff with. A lot of that has to be moderated. We are in as we talked, I think, earlier on about this too, it can be dicey in these communities. You don't want these communities to become a trade community for all sorts of other stuff. So you need to be tight on the community. So we're going to train some of these folks. We have a fellowship-like program. We're going to pay. Even your colleague, Nathan,
Gabriel, yeah.
Gabriel Nathan may be involved. It's something he does. This is a great thing. So yeah, online community is different, no question. COVID, it's made it more real.
Yeah.
Online wellness or group sessions is more affordable. I mean, more realistic. Right. These veterans aren't going to get up and drive to a psychiatrist's office. I don't think it's going to happen. It's not how they relate.
Right.
So this substitutes for some of that, but it's again, I think it's an extension of meeting each other in person, which they continue to do. And one of the things that we're hoping over time, because this is limited mostly to the California area because of the law, we're thinking the day may come where some of these dispensaries that are participating in our registry that we're going to run through dispensaries might also be able to extend the model for Weed for Warriors for distribution. Again, this is going to happen after marijuana is descheduled as a narcotic.
Right.
But, that's going to happen. And this program needs to grow, and it needs to be across the whole United States. And we can get that done with patience, a little persistence.
Two more questions for you guys before we go. What do you hope to accomplish, or where do you hope, based on your organization's goals, where do you hope will be, what improvements do you hope you'll see in the next 5 years, say?
For me, it'll be better outcomes across the spectrum of people with opioid use disorder, people dependent on opioids. That's different than being addicted, that don't want to be dependent on opioids. For veterans with PTSD, helping better to manage their anxiety and their depression. We may not get rid of opioids. Opioids work. That's the strange thing about them. But we know statistically that if an opioid user could substitute a couple of doses a day of opioids with a cannabis or a cannabinoid, they're not going to die. So for me, it's just outcomes. Right now, I don't know 5 years, 3 years, I want to see an improvement in outcomes.
3 years. We could do 3 years if you want, Brian. That's fine. Sean?
I would say the Weed for Warriors is synonymous with access. And I think that's a great nexus for us to be at, because access gives us these positive outcomes. And so to us, it's about access. So it's about fighting like we did in California for SB 34, which is a bill that allows companies like Columbia Care, and they're working with us to donate free cannabis, no taxes, to a medical patient, a veteran patient with a medical script, proof of service, and state ID. And so that's what we're working on. This enables us to take this veteran population and give them other tools, as Brian said. What I hope in 3-5 years is we have to send that model we perfected in California at SB 34 and get that enacted in more states. And then on the federal level, we need smart policy. smart policy that empowers the individuals, that is about making the smart, safer choice. And the safer and smarter choice we are learning is cannabis. And that should be available to anyone who wants it. And yes, opiates work and they should be used where properly and where people want them. But a lot of people are voting with their own feet and they're voting cannabis. And this is a reality. They're going to smoke it and use it, whether you want it legal or not. So let's bring it into the safety of a legal, regulated marketplace that doesn't have the side effect of a black market. And the only reason way you get rid of a black market is you have to compete against it. We don't have a black market in alcohol in California because it's accessible. That's the measuring tape we need to use.
Thank you. And for our viewers, I will include the links to both of their organizations in the podcast description. So you can go to their websites, check it out, contact them, do a Zoom call, maybe. I don't know, whatever you want. Thank you both. It was great. It's always educational. I always learn something. I learned something last time I talked to you guys, learned something this time.